look at the data on lithium, it seems to be that lithium in public water supplies actually reduces your risk of suicide. How does it do that? Lithium has some interesting effects within the brain as far as neuronal firing. That's why we'll use it in diseases like bipolar disorder to treat these folks and help them stabilize their mood. So what do we find? Lithium seems to have a protective effect in reducing the rate of completed suicide in the population, i.e. the more lithium in the groundwater, the lower the rate of suicide. This has been found many times in many different places. This data set is from Lithuania. They find that it's most significant for men. And then when you do some other adjustments, it only remains significant for men. Men are the majority of suicides overall. This is a very, very important matter of public health. And I think it's a shame that we're having lithium deficient waters. Never before more in history than now do we have low magnesium levels in the water, or sorry, lithium levels in the water, and we've got an epidemic of suicide. This does not mean you should all go out and take lithium supplements. Those are much higher doses than these lithium levels. In this next paper, we see that it's suggested that there may be an impact on lithium levels in the hard water question, i.e. the lithium and the magnesium are both important. If you're looking at these studies and papers, you'll notice that many of these are old, 1970s, 1960s. I read ones for this video that went back to the 1950s and 40s. No one has any skin in the game of improving groundwater levels of minerals to reduce rates of disease because nobody gets rich adding minerals to water. I help patients understand how they should get minerals in their water when I actually consult with them and look at their levels, because you can do mineral replacement any number of different ways. You can use concentrated liquid minerals that you add back to water. You can add mineral components to reverse osmosis filtration systems. You can do lots of different things. And you can also use just supplements and then reverse osmosis or otherwise filtered water. So it's a long story that I tailor to patients clinically, but it's not just as simple as one or another element. It's all of them put together. Now, is there any downside to this? It's always important to ask questions when you're thinking about doing something. Is there any conceivable way that this would hurt me? There is no known adverse effect profile for hard water. It's just not that the benefits are significant enough for experts in the conventional public health world to recommend it or care about remineralizing your tap water, which is grossly mineral deficient. Let's take a quick look at different spring waters. These are the really nice high quality beverages you might be getting at, say, a high-end grocery store or at a really high-end restaurant, right? These are some of my personal favorites. They've all got very different levels of minerals in them. So let's take calcium as just one example. You'll notice that and these are all for the same quantity of water. It's all 1 liter quantities. So Gerolsteiner has got twice as much calcium as the next highest, which is San Pellegrino, which has twice as much as the next highest, which is Evian, which have, together with Mountain Valley, about the same amount. They have 4 times or more the amount as Fiji. Then you come down to magnesium. Gerolsteiner, again, the hardest water in this category, 100 milligrams of magnesium per liter of Gerolsteiner. If you drink 3 liters of Gerolsteiner in a day, you just got 300 milligrams of magnesium. A lot of your supplements for magnesium contain things like magnesium glycinate, which to get therapeutic levels or dosages to really replete somebody, you got to go up to 400 to 1,000 milligrams. Supplements are somewhat misleading in the amount that they're giving you, in that you have to remember that the gram quantity they're giving you or milligram quantity they're giving you is adjusted to include the thing that's attached to the mineral. So in magnesium glycinate, there's the magnesium ion, and then there's the glycinate that's chelated it. It's an amino acid. So it actually is only a proportion of the magnesium glycinate that's actually magnesium. That's why, for example, 125 milligrams of magnesium taurate and 125 milligrams of magnesium glycinate are not the same amount of magnesium. It's the difference in the weight of the amino acid that it's complex to. Okay, so your magnesium content varies significantly with bottled water. If you compound this, right, over years and decades of your life, it has a very substantial influence on your total body magnesium level. You'll notice that potassium is a bit player in this tale, but it must not be forgotten that potassium and magnesium play together and you can't optimize levels of one without optimizing levels of the other. Sodium is a total bit player in this. Really high quality drinking water doesn't have sodium in it. I use sodium only in people who we've got some kind of autonomic issue, or we've got a concern for performance enhancement. They want to be performing better on the field or on the track or wherever they're exerting themselves, because that's the way that you really that's where you use sodium. And I don't want to, say using sodium on your food. I salt my food. I think it's healthy. But these other minerals, the magnesium, potassium, they tend to be deficient in people, and they tend to have really profound clinical implications thereof. So the bottom line for this video is pay attention to where you're getting your water. The modern soft waters coming out of your tap water, filtered waters, they're not repleting your body with minerals. And you can be doing this if you're repleting or replacing minerals in your even in your tap water. Not that I'm saying you should drink tap water, but in your filtered water, you can replace the minerals. And if you're not replacing the minerals, you've got to think to yourself, what's the long-term outcome for my mineral status if I'm not getting this very important and very significant mineral load from my water? This has clinical implications. That's why I monitor mineral levels in patients no less than once a year is my recommendation to them. So as always, thank you for watching. Make sure you like, comment, share, subscribe.